A heartfelt email from an MSA patient. Hi everyone, I'm Dr. Michael Johnson. I'm a board certified chiropractic neurologist. I've been in private practice in Appleton, Wisconsin since 1983, and I'm the clinic director and founder of the Optimal Health Stem Cell and Wellness Institute. So MSA, multiple system atrophy, there's two main types, MSAP for a more Parkinsonian type disorder where they have the tremor and the stiffness, and then MSAC, which is more cerebellar based. Cerebellum is the back part of the brain, controls your balance and coordinated movement. So they have difficulty, obviously, with their balance, their movement, their speech. So the bottom line, it's unfortunately in the medical world a death sentence. Many patients are just told to go home, get your affairs in order. It's only a matter of time. And that doesn't have to be the case. We have a patient, we've seen her for the past 6 months, Gail. I will have her update videos below. There's 3 of them. So in 6 months, we've done 3 updates. She's continuing to improve week by week, month by month. She's moving better. She's walking better. She's talking better. Across the board, she has improved. And I'm going to share with you how. And I have the video below on the MSA, multiple system atrophy treatment success, 7 revolutionary keys. And I'm going to be going over some of that with you in this video. Take a look at those videos on Gail, her updates, my MSA video. So I received this email yesterday from Lester. Lester's in North Carolina. Dr. Johnson, can you help someone diagnosed with multiple system atrophy? The answer is yes. Okay, just because a medical doctor, their drugs and surgeries don't work, doesn't mean there's no hope for the patient. And I'm not trying to blow smoke up your backside. Watch the videos of Gail. Talk to her husband, Dan. Because they were told by not 1 but 2 physicians at the famed Mayo Clinic to go home and die. So, can you tell I'm a little passionate about this? Just a touch. Because we've seen such wonderful change with Gail. And we continue, and there are some other things we're going to be doing with her. I'll get into it in a minute. Here's my wife's history. It began with her not being able to move her legs. We went to a neurologist who said she had Parkinson's and prescribed levodopa. So it's a lack of dopamine. Dopamine is in the brain stem. Okay, the pontomedullary region, substantia nigra is where dopamine is very important for moving. Dopamine, for those of you who don't know, it is a neurotransmitter like serotonin and GABA. She progressively got worse and felt like she was choking, and the doctor pretty much ignored her complaint. Well, that's common with MSA patients, that they have this choking feeling or trouble swallowing. It's terrible that the doctor pretty much ignored the complaint. We went to another doctor at Duke University who agreed with the initial diagnosis, scheduled another appointment in 6 months. So this is what physicians do. Let's wait and see. Let's watch. Let's see what happens. Not much we can do for her. There are things you can do, and we'll get into it. She continued to get worse and attempted to call the doctor, and calls were not returned until the 5th attempt. That's terrible. We then called University of North Carolina Hospital and found another neurologist who diagnosed her with multiple system atrophy. She prescribed physical therapy. Since my wife had bad side effects from all the medication, she said physical therapy was all that they could do. My wife went to physical therapy and it seemed to help. Had to stop physical therapy because of her bad knees. Basically, we were told that nothing can be done. Present symptoms: balance problems, choking problems at least once a day, coughing, constipation, cannot walk without some assistance, speech problems, severe pain, shoulders, neck, back, arms, knees, going to an orthopedic doctor in August, exhaustion, curling toes on one foot, swallowing, tightness in throat, gradually getting worse, moving to face, getting harder to breathe. And she's basically taking CoQ10 and a B vitamin. If you can be of assistance, please let us know. You might be our last hope. Thank you for any help. Lester and Sharon. Well, first of all, I hear you might be our last hope a lot. Many, many times during the course of a week. I get hundreds of emails. Now, this past week for me has been extremely frustrating because YouTube has terminated my channel, Dr. Michael Johnson. I don't know why yet. I have appealed. Hopefully, if you're watching this on our channel, Optimal Health Stem Cell and Wellness Institute. But it's frustrating. But the reason that I continue to do what I do and the reason I push back on YouTube is because of emails like this. People that we can help. So the first thing I'll say, yes, we do stem cell therapy, but it's way more than stem cell therapy. Stem cells into the brown fat. So umbilical cord stem cells, they're the youngest types of cells, into the brown fat, very important. Very important. That's a big one. The brown fat contains the highest concentration of mitochondria. But it's not just stem cell. We do complete blood work because if you're loaded with systemic inflammation, stem cell therapy isn't going to work. 25% of the patients in our office had stem cell therapy. It didn't work. The reason is they're loaded with inflammation. So complete blood work. And I have a video on what we're looking for, but I'll just briefly describe. We're looking at, obviously, blood glucose levels. Because your brain and nerves need two things to survive, fuel and activation. Fuel is oxygen and glucose. We do utilize oxygen in our office with PEMF, pulsed electromagnetic field therapy. PEMF helps the stem cells grow and differentiate. We're looking at something called Brown's gas, which is hydrogen and oxygen, which just kicks it up a notch. So complete blood work, we're looking at their kidney function, liver function, gut function. Do you have enough HCl that you're absorbing the food that you're eating? Your red blood cells, your white blood cells. We're looking at your inflammation markers, C-reactive protein, homocysteine, ferritin, fibrinogen, uric acid. We're looking at your thyroid function, your lipid panel, your vitamin D level. Your vitamin D level should be 80 to 100. So that's what some of the highlights that we're looking for in the blood work. So it's more than just stem cell therapy. We also look at pregnenolone. Pregnenolone is the fat that makes up your brain and the myelin sheath around the nerves. So pregnenolone, along with vitamin D, vitamin A, vitamin K1, vitamin K2, very important for fat in the brain and the myelin sheath. How do I know this? I have MS. I have MS. All of the things that I'm talking to you about have helped me personally. So we want to look at pregnenolone. Pregnenolone is made from cholesterol, so you want to look at your cholesterol level. So cholesterol, the body takes it, makes pregnenolone. Pregnenolone makes DHEA, and then it comes down and makes testosterone, and it makes estrogens. There's 3 estrogens in women, E1, 2, and 3. It comes over here, makes progesterone, and then comes down here to make cortisol. When people are stressed, even health stress, it's called the pregnenolone steal. The pregnenolone all goes down to cortisol. Normal pregnenolone level, about 200 with an MSA patient. And most MSA patients are so low that it can't be measured. Have you had your pregnenolone measured if you're an MSA patient? And why haven't you? Because it's so vital for your brain and nerve function. It's crazy. Just crazy. And I go into it, and I have a separate video, and I can email you information on how important pregnenolone. I'm just giving you one aspect of it. So, we also obviously look at hormones. So if your pregnenolone's real low, there's no point in checking your hormones with a Dutch test. You can go to Dutch test, DUTCH test.com, read about it. So we do stem cells into the brown fat. We do complete blood work, complete hormone testing. We also do complete genetic testing. So you can have genetic SNPs. You've heard of 23andMe. We stopped using them. They don't do as many SNPs. We do most of it in-house, or we may use another kit that we can get off the back end. But you're looking at SNPs such as MTHFR. That is looking at liver function, or MTRR, which looks at your B12 absorption, or VDR, which looks at your vitamin D absorption, or GAD. GAD is converting glutamate to GABA. So glutamate's excitatory, GABA's inhibitory. We're looking at MAOA and MAOB. That's looking at dopamine and serotonin levels. Well, obviously, MAOB, dopamine levels, very important for the MSA patient. So you see, you have to do complete testing. Complete testing. We look at trigger testing, toxins and infections. If you don't clear underlying toxins and infections out of an MSA patient, they're not going to get better. We utilize a portable PEMF unit up on the head, up on the brain. In Gail's case, we put it right here on Broca's speech area. Broca's speech area allows me to communicate to you. Wernicke's area, back here, allows me to understand what you're saying to me. And there's a connection between two called the arcuate fasciculus. So that's kind of neurology 101. Every neurologist knows that. Why aren't medical doctors doing anything about it? Because if drugs and surgery don't work, they don't know what to do with an MSA patient. So what we did with Gail is we put the coils, we stack them. They come with the smooth side and the ridge side. We put the ridge sides together, stacked it right on Broca's speech area, had her wear a headband. It's just a little portable unit. I had one here, I don't now. And it helped her speech. That's something you can do immediately. You can go to micro/pulse.com. Right? I'll have this down below when I get the chance. And it's the A9A unit, A9A, capital A, number 9, little a, or small a. And it's $429. If you type in Dr. Johnson, you can get my discount. If you want to work with me just on the PEMF unit, I do charge for my services, so it is a little bit more expensive. But if you just want to do it and start utilizing it, there you go. So that's important. The PEMF, pulsed electromagnetic field therapy, it increases frequency of firing of brain. We may put it on the frontal lobe or on the cerebellum. We've done both with Gail. That's part of why she's improving. We also do something called neural reset therapy. So you're firing receptors in muscle, joint, sorry, it's a Friday morning. I'm getting tongue-tied. Muscle, joint, and tendon. So muscle spindle cells, joint mechanoreceptors, Golgi tendon organs. Those are receptors that fire up the back part of the spinal cord, called the dorsal columns, up to the cerebellum, up to brain. Cerebellum fires to frontal lobe. Frontal lobe fires down to lower brainstem, pontomedullary region. So with most MSA patients, you've lost that ability, that frequency of firing. And we also utilize something in the office here called QNRT, quantum neural research therapy. This is where we're using lasers, red and green lasers on different acupuncture points. And finally, as I mentioned earlier, we're just getting into Brown's gas. Brown's gas is a combination of hydrogen and oxygen. We currently use oxygen in the office now. But as you can see from the videos below that I will post of Gail, she's constantly improving. We're going to be doing something here within the next month that I think will bump it up even more. I can't get into it now. It's in our R&D, research and development, and I'm not being facetious. So that's how we help MSA patients. So when I get an email like this, when people are telling me you might be our last hope, this just breaks my heart. And it helps me overcome these hurdles, like YouTube, unfortunately, terminating my Dr. Michael Johnson channel. Such as we had my email hacked this past February. So people were not getting or receiving emails from me. Facebook has booted me off their platform. I think we found out eventually why, because we used the term ED in an ad for erectile dysfunction. I mean, are you kidding me? It's a factor of life. And honestly, ED, erectile dysfunction, happens with males who have MSA. So all of these challenges, but yet what keeps me motivating, what keeps me going, what keeps me getting up in the morning is helping patients like Gail and helping patients like this poor woman, Sharon, who, yeah, they've been told nothing can be done. Well, something can be done. You don't have to go home, get your affairs in order, make them as comfortable as possible, and watch them wither away. You don't have to do that. I mean, Dan and Gail and their daughter Janelle chose not to do that. As a matter of fact, how that all came about was I got a PM on Facebook from Dan and Gail's daughter Janelle. Hey, do you do anything with MSA? I said, yeah, I've had MSA patients in the past and we've helped them. I think we can help your mom. We are helping her mom. Now, do I have any videos of those other patients in the past? No, I'm sorry, I don't. But we are monitoring Gail, and we're already seeing a tremendous change in her just in the 6 months that we have been helping her. And again, stem cell therapy, everything we do, it doesn't treat or cure MSA. It supports the body to allow for maximum healing. When you cut yourself, it's your body that does the healing. So for physicians to tell patients to just nothing can be done, go home and die, it's criminal. It's criminal. And you'll see that, and I'm quite passionate in my MSA video. I really am. Because I just think it's terrible to tell a patient that there's no hope for you. Yeah, without your drugs and surgery, but drugs and surgery are not the end-all and be-all. I'm not anti-medicine. I mean, medicine does a great job in acute care, broken bones, heart attack, stroke. But when it comes to chronic conditions like MSA, physicians are lost. They are lost in a lost world. I make my living, and I have for over 36 years, on the medical doctor's failures. That's as blunt as I can be. They don't like hearing that. I don't really care. I don't care. I don't like a lot of MDs. I think they're pompous jerks. Not all of them, because some of my best friends are physicians. They're not pompous jerks, obviously. Many of them are radiologists. One is an OBGYN, and I have another who's a dermatologist. I'll be honest with you, we never talk about healthcare. Talk about anything else but. So I'm not anti-medicine is what I'm saying. I am anti-jerk-offs, moron doctors is what I call them, MDs, when they treat people poorly. I mean, it takes 5 attempts to get through to a doctor when this patient's getting worse. Absurd. So that's what we do. Again, let me just recap it. You can watch the other videos below. But it's stem cell therapy, umbilical cord stem cells into the brown fat. Why the brown fat? Highest concentration of mitochondria, helps cross the blood-brain barrier. It's complete blood work. It's complete hormone testing. It's complete trigger testing for toxins and infections. It's complete genetic testing, and I told you all why. Using the PEMF on the head, we also use it here in the office. Utilizing QNRT and NRT, I have videos on those. I can put them below. And finally, we're looking at Brown's gas, and we haven't done it with Gail, but I do plan on utilizing it with her. If you have any questions, email me. Email is the best way to get a hold of me. I'm at drj@ohstemcell.info, drj@ohstemcell.info. Share this video. Will you help me help other people? Seriously. Just share them with people out there with MSA, and let them decide. If it's for them, great. If it's not for them, I'm not twisting anyone's arm. Okay? All I'm doing is giving you information, and you can decide. If it makes sense to you, let's go. Shoot me an email, drj@ohstemcell.info. I'll have the information below. I'll have the link for the micropulse PEMF along with the code. I will have anything else that I think is of importance, the videos as I mentioned. But subscribe to this YouTube channel. I mean, I had 50,000 subscribers before YouTube terminated my Dr. Michael Johnson channel. And again, I haven't found out why, but we're looking into it and we have appealed. And now we have, as I'm making this video, like 800. So share this video. Share it on social media. Share it on Facebook. Share it on Instagram. Share it on YouTube. Share it wherever. Help me help other people. because you don't have to go home and die. I'm Dr. Michael Johnson. Thank you for taking the time to watch this video, and I look forward to helping you in the future.